The topic of dying is not a pleasant one to discuss. However, in these present days, it is time to stop avoiding the matter. There is an intense debate happening, and legalizing euthanasia is at the center of it. For those that don't know of this term, euthanasia is derived from the Greek word euthanes, which means easy death. It means ending the life of a very sick person in order to alleviate their pain and suffering. Although this sounds like a kind thing to do, in my opinion, legalizing euthanasia is not a healthy choice to make for the society for 3 reasons. It is ethically wrong. It will be the first step in creating even bigger problems. It sends a wrong message to the public. Euthanasia is not anything new. There are parts of some countries that are practicing this option already. In the Netherlands, physicians have already begun mercy killings using lethal amounts of sedatives and to terminally ill people they believe have no free will. This is called involuntary euthanization and is performed on people including children, the mentally retarded, and those left in irreversible comas. These individuals have died because it was decided for them. The fact that a physician is assisting in their death does not justify it to make it any different than a premeditated murder. Each year, the number of patients that are being non-voluntarily euthanized is increasing, and we are witnessing people, sometimes even strangers, deciding if a person's life is worth ending or preserving. This doesn't sound right. Accepting euthanization accepts that some lives, such as the sick and disabled, are worth less than others. I understand living in a vegetative state sounds like a horrible way to live, and that legalizing euthanization would provide a solution for a baby being born with a terminally ill disease. But whatever happened to working towards a cure? This brings me to my next point. We are failing to realize the potential problems that we are creating if we allow euthanization to happen legally. As I stated in the beginning, euthanasia comes from the word that means easy death, and it is. It is an easy solution that we are providing patients and physicians once it's been classified that a patient is chronically or terminally ill. I believe this in time will cripple motivation for physicians to advance in healthcare and develop more remedies. Now, those that want to legalize euthanasia would argue that this is just one theory, but I have more than one. See, most of us are probably thinking that if we give the people the option to die on their own terms, we are only affecting and helping those that want to die. But that is not the case. We are opening a door to decrease costs of a part of healthcare, and it's going to affect everybody. We can already see insurance companies attempting to pay as little as possible with increasing premiums, denying expensive drugs, and rejecting treatment for a patient. Can we really trust them to not take advantage if we legalize euthanasia if it meant saving them millions of dollars? Why are we trying so hard to approve this easy solution instead of enhancing the alternatives that we have now, such as palliative care? This type of care focuses on relieving the symptoms of a serious illness. We also have hospice, which provides a home for the chronic and terminally ill. If we allow euthanasia to be a lawful thing to do, insurance companies are successful in denying more treatments, is it really the individual deciding if they want to live or die? Now, I have read the arguments and seen the campaigns to legalize euthanasia. They are devastating, and I can see why a person would want to die. I never said that I didn't agree with these arguments, but unfortunately there are just too many potential problems that are bound to occur if we let euthanization become allowable, such as those I previously stated. And I cannot overlook the fact that euthanization also sends a wrong message to the rising generation. The younger age are not mature enough to understand controversial topics like these. If we approve the act of denying because we want to, we are sending a mixed message about suicide, and that's the last thing that they need. Even those that have reached adulthood and are suffering from depression are in danger of euthanasia. This is because suicidal thoughts are usually associated with depression, and research has shown that when depression is properly treated, majority of people change their minds about wanting to die. Just because we are giving a patient a choice to live doesn't mean it's the right thing to do. Although euthanasia brings relief to those that could very well use it, and those that want it legalized have some strong arguments when we are deciding something for When we are deciding something for millions of people, we have to choose the option that will become less problematic. And so I urge you to think about this when deciding if legalizing euthanasia is a good option for our society. Thank you.
Oh my god. Wait,